Hi. One of the biggest problems that I see in runners and is responsible for a huge number of injuries is stiff ankles. Sometimes it can be your calf muscles, but more often than not, people have stiff ankle joints that stop them moving properly. And if one side is stiffer than the other, and it could be from a sprain 20 years ago, might even be something that you're not aware is causing you problems. But one stiff ankle or one ankle stiffer than the other can cause a huge amount of problems further up the chain. So it can cause problems with your knees, your hips, and your lower back especially. So let me teach you how to identify whether your ankles are stiff and then what you can do to help them. Right, here's the test for stiff ankles. What you need to do is stand with your feet about shoulder distance apart and your heels need to stay on the floor. So don't let your heels lift up when you do this test. Let your knees bend forward as far as they'll come without your heels lifting up. And then what you really need to do here is identify where the restriction is. So when I do that, or when you do that, can you feel it through here? So through the front of your ankles, can you feel the shin muscle here? Or is it your calf and Achilles you feel? Now, if you have any pain or restriction in through the front, so if you can feel something jamming up here, or if you can feel this muscle here working really hard, that means your ankles are stiff. Your ankles are causing a block to the movement before your calves are getting a chance to stretch. I'll show you that from side on. So, heels on the ground, knees going forward, and then what we're looking for there is if there's a difference, especially between one leg and the other, and of course where that block is. So, I'll exaggerate it here, but if my left knee got that far and my right knee went further forward, then we'll know there's a pretty serious or a pretty obvious problem in fact that one foot or one ankle is doing something different than the other. So if you give your ankles one of those tests and you find that there's restriction in the front or that front muscle is switching on or that there's a big difference in between one and the other, then you need to know what you can do to your ankles to help improve that mobility and therefore improve the way that everything moves further up your body. So let me show you a technique or method to be able to do that. Right, in order to get your ankles moving properly or loosen them up, you need a bit of equipment. Now, one of the most convenient and easiest ways that we've found to do it is to get one of these really strong resistance bands. So we have them, you can buy them on eBay usually. We have them available in our physio clinic and also on our locker room shop. This is one of the stronger ones that I've been able to find. Make sure you don't get one that's too thin or without enough resistance. It actually needs to be quite strong. So let me show you how to use it. So to use the green band, you need to tie it around something that's really solid. So maybe a couch. Actually, if you can get someone to hold it for you, it's really good. I'm lucky I'm going to put it around the physio bed here, and the physio bed is pretty heavy. So what you do is tie it to something, and then you put your foot inside the band, and we want that strap to be down pretty low. So see how there it's right down over my ankle joint. And then what I'm going to do is stand up and put quite a lot of tension on the band. So I'm going to pull forward so that the band's really tight, and that feels like it's digging in. It's digging in quite a lot there into the front of my ankle, so I can feel quite a bit of pressure there. Right, so that is step one. And then what we need to do is a series of lunges into that band. Right, so with that band around the front of my ankle, lots of tension on it, other leg at the back, I'm then going to do some lunges. So I'm lunging forward, trying to encourage this knee to come as far forward as I can over my toes. And I'll do one sort of pretty straight, and then I'll do one slightly towards the outer border of my foot. So I usually call it second toe, fifth toe, second toe, fifth toe. And you do about 10 or 15 of these lunges for each toe. So 10 of those, 10 of those. And what will happen is it'll feel like it's digging into the front of your ankle, but over the period of those 15 to 20 lunges, you'll gradually get a little bit more mobility, or it will free up the front of your ankle. I'll show you that from side on as well. Right, so here it is from side on. So lunging forward, coming back, and there's my fifth toe, second toe, fifth toe. So after having done those lunges, your test is you can do that bending forward test again, and then if there was previously pressure through the front of the ankle or through the front of the shin, hopefully now what you'll find is that your ankle moves far enough forward that you can actually feel tension in through the back. Let me show you that from the side on. So knees bending forward. So now, instead of my ankle feel like it was jammed up or my shin muscle feel like it was working really hard, my knee drops forward, it comes forward slightly further, and then most of the tension is through my calves. And now you'll get a much better effect out of trying to stretch your calf muscles or get a better stretch with the hunter-gatherer squat, for example, because the ankle is no longer the limiting factor. Right, so there we are. That are the tests you need to do in order to identify whether you have stiff ankles and whether those stiff ankles are causing any problems. Like I said earlier, having one side stiffer than the other causes a lot of problems further up the leg. Knee pain, hip pain, back pain especially. So if you can identify whether you've got stiff ankles and you can sort them out using one of those big resistance bands and doing the lunges like I just demonstrated, it will make running easier, make your body feel better and make you more efficient. Good luck.